This is the NUR 265 hand hygiene, non-sterile gloving, and sterile gloving competency. First thing the nurse would do is verify the healthcare provider's orders. The nurse would then gather the necessary equipment and supplies. We have a hand rub, we have non-sterile gloves, we have sterile gloves, we have disinfecting wipes, and another container of hand rub. The next thing you do is introduce yourself with name and credentials.
So I would be saying to the patient, hello, my name is Marge Waterworth. I'm an RN and I'm going to be your nurse for the day.
The nurse also provides for privacy.
So we would pull a curtain or shut a door.
The first skill we'll perform is hand hygiene with soap and water. So Marge pushes up her sleeves, pushes her watch up, removes rings, and you'll see those are all off right now. Standing in front of the sink, she's going to keep her hands in uniform away from the surface of the sink. Turned on the faucet. She's going to avoid splashing water against her uniform, and she's going to use warm water for the skill. She wets her hands and wrists, keeps hands and forearms lower than her elbows. She's applied the recommended amount of soap to her hands and lathered it up thoroughly. You wash your hands for at least 15 seconds. She needs to clean under her fingernails with the nails of her other hand. And when she rinses, she does it with her hands and wrists pointed down. After she's done washing her hands, she will dry them thoroughly using paper towels. You could have the paper towel folded up next to you if you have room on the sink. When she's done with that, she can discard the paper towels in the garbage can. And if she were turning the sink off with her hands, she would do it with a dry paper towel against the controls. After that, another safety item will be identifying your patient using two identifiers. So you will ask the patient's name, birthday, or MRN number. Those are the three identifiers that a nurse can use. You go back to the WOW and you need to identify allergies against the patient's records. You also need to ask the patient if they are allergic to anything and check their armband. If you were going to do a procedure at bedside, you need to explain that procedure now. Now we're moving on to applying the non-sterile gloves. So you are going to select the appropriate size of non-sterile gloves. We have medium in front of us now. You put your hand through the opening of your first glove and pull it up to the wrist. And then repeat the same technique with the next glove. Make sure your hands are dry, or it will be more complicated to put your gloves on.
As I am demonstrating that.
These are not sterile, so you can touch them. She's going to put her second gloves on, and once she gets her second glove on, she can adjust at the wrists and the fingers. Nurse will perform any skill that was happening. In front of us we have some dirty gauze. So once you're done with that, you've contaminated your hands. When you take your gloves off, you are going to touch glove to glove and skin to skin. So go ahead and take your gloves off. You grasp the outside and take the first one off. You use your finger underneath the other glove to get the other glove off. You'll never touch what's contaminated in the glove or on the glove. And then you are going to discard them in the garbage. We are now going to perform hand hygiene with the antiseptic rub. You get an appropriate amount of rub on your hands and cover your palms, back of your hands, interlock your fingers, clean your thumbs and your wrists. You do this, you let your hands dry, and then you can start with your sterile gloving. So Marge is going to remove the outer glove wrapper by peeling the sides apart, and then she's going to take that inner package out. Throw that away. She's going to open the package, keeping the gloves on the inside surface of the wrapper. She wants to identify which is her right glove and which is her left glove, and she will start gloving with her dominant hand. She can grasp the outside of that glove and pull that onto her hand. Sterile gloves can be a little more complicated because they fit tighter and are supposed to, so you're not contaminating. She can only adjust that glove by touching the inside of the glove. She can now slip her fingers into the inside of that glove and try not to touch her other hand with any part of the sterile glove and pull it on. She can now adjust anything wrong with that first glove because you are touching sterile glove to sterile glove. There you go. You now are going to verbalize that you will do a particular sterile procedure. Talk to the patient about that. Once that sterile procedure is done, you will remove your gloves the exact same way you removed your clean gloves. Glove to glove, skin to skin. And then you're going to throw that away. You performed hand hygiene one more time with your antiseptic rub. We are done with all of our procedures. We're going to assure that our bed is in the lowest position possible. We're going to make sure the wheels are locked, the side rails are raised. We're going to make sure our position of our patient is comfortable for them and their call light is within reach. And you are done with that procedure.